Cullen, and today we'll be talking to you a little bit about craniosynostosis and what exactly it is. My son was born on November 6, 2020. The doctor came into my hospital room and told me news that no mother is ready to hear. He was officially diagnosed with a rare birth defect called craniosynostosis, only after numerous x-rays and testing were done. My son's dad and I were scared to hear this news, but we knew either way we were going to have a perfect son. We knew truly little about craniosynostosis at the time, but after further examination, the doctor revealed that my son's dad also had this and probably wasn't aware because it was such a mild case and also nothing was ever done about it. This news was also a big shock to us at the time because neither of us knew he had it or even knew what it was. We had to do a lot of research to learn about this defect so that we could fully grasp what steps we needed to take. Craniosynostosis is extremely rare, but it is a birth defect that people should educate themselves about because it can happen to anyone. It is very important to my family and I that we share our story and educate people on this topic. Craniosynostosis affects more males than females. People are not quite sure why this is the case. It's a common diagnosis in children younger than 18 months of age, although it is possible to not be caught till an older age. Sometimes the case is so mild at birth that it's not even recognizable until the child is much older, or even sometimes until they reach adulthood. There's a few different surgeries that can be done to correct craniosynostosis before it turns problematic. Cranial vault remodel, it's also called CVR surgery, is done by making an incision across the top of the skull from ear to ear and temporarily removing the skull bones. It's called a craniotomy, reshaping them and replacing them to form the skull in their new shape and arrangement. So the reshaped bones are secured using synthetic plates and dissolving screws, and sometimes they use dissolving sutures. A clear advantage of this versatile type of reconstruction is that it allows the surgeon to precisely reshape an area of or the entire skull. Another surgery that can be done is endoscopic surgery. This technique does require there to be a helmet worn after surgery. A lot of parents choose this surgery because it is less invasive, but it doesn't always work, and the patient ends up having to get CVR done anyways, the cranial vault remodel. It's a small incision right in the front, and it involves less blood loss, so that's why a lot of parents choose this as well. And after surgery, your child would have to wear a helmet for several months, and the helmet molds their head to shape that allows for normal brain growth. My family's experience with this entire process has been difficult. We chose the cranial vault remodel method. It was a total of 4 days in the hospital. The first night was probably the best because the swelling didn't start yet, and on the second night, one of my son's eyes had started to swell shut. And by the next morning, he was completely blind. He was really scared, and there was no way I could tell him things would be okay, and that's one of the hardest things about this surgery method. The kids who get the surgery are confused, and they can't even open their eyes anymore, so it lasts about 3 to 4 days of him being this way until he could finally crack them open a little bit at the bottom and see just a tiny bit. The swelling of his scalp and forehead area took about a month in total to completely go back to normal. And the post-surgical healing for cranial vault remodel surgery is a lot harder than the endoscopic surgery just because of how invasive it is. And as of today, almost 2 months later, we still have to go about once a month out of town to Richmond to where he had the surgery at for a follow-up, which will turn into every 6 months and then every year. So to summarize, craniosynostosis affects thousands of families every year and is a very hard process to be put through. It requires some pretty traumatic surgeries and sometimes even multiple surgeries to get the skull shape to a normal size for proper brain growth.